I want to welcome everybody to the Live Well Kalkaska Substance Free Coalition's Coffee with the Coalition Forum. This is an open and informal discussion focused on substance use disorders as well as related topics and concerns affecting the Kalkaska community and the broader Northern Michigan region. And I'd like everybody to introduce themselves. Let's see. Amy, you want to introduce yourself?
I'm Amy Muller. I am the Recovery Care Services or the Health Home Coordinator for Catholic Human Services. So it's nice to see everybody.
Great, thanks. Linda?
Hi, I'm Linda Solom, and I'm a certified prevention specialist for Grand Traverse County, which is an initiative of Catholic Human Services. And I'm a colleague of Suzanne's.
All right, thanks. John?
Hello, John Supernaw. I am a peer recovery coach and kind of community point person for Catholic Human Services.
All right, thanks, John. Lauren?
Morning, everybody. My name is Lauren Clark. I'm a Kalkaska County resident and also a resource specialist for OS reentry with Networks Northwest.
All right, everybody. And I'm Suzanne Prentice. I am the coalition coordinator and prevention specialist for Kalkaska County through Catholic Human Services Up North Prevention. And today we are welcoming Renee Cunningham, Health Home Nurse Care Manager at Catholic Human Services. Renee will be presenting on the Recovery Care Services through Catholic Human Services. Go ahead, Renee.
Thank you. So looking at Recovery Care Services, our recovery team, we have a collaboration between, there's a coach, a counselor, a nurse, and then we have a physician. We have a clinic every month that our doctor comes in and provides services, whatever it may be, injections, whatever is needed for that client. It starts out by being contacted. We are contacted either by the client or whatever it may be. And then we set up services based on their needs. We have grown quite significantly. We started out with, I believe, around 40 in 2022, I believe it was, Amy. And right now we're around 200 clients. So we are really growing. Our services are working. So what we do, we bring the client in, and it starts, like I said, with a coach, or a client, counselor, sorry, and they meet with them, kind of go through an assessment. And then we also bring a coach in, and the coach will provide services such as, do they need AA meetings, NA, whatever kind of networking, or, that available services to them. And they meet with them also and coordinate services. And then myself, being a nurse, I will also assess them. We do vital signs, and set up if we notice maybe their blood pressure is high or weight, provide education. And we also do a care plan, and it identifies their needs, and we all share that care plan. So we're all kind of working together collaboratively on everything to make sure that we're meeting their needs. We follow them for, as long as they want to be in the program. What we do is typically the counselors meet with them more frequently than we do. I usually will contact them at least monthly and sometimes more based on need. Sometimes it's every week, it depends on that need there. And same with the coaches and the counselors. So it kind of varies based on their needs. We have offices, in the Gaylord area, Alpena, Cadillac. I work in Cadillac one day and then in Traverse City. So we have a nurse in both locations now. So it kind of helps us there. And we have a nurse over in Gaylord and Alpena area. So they cover that area and then kind of provide the services there. It's a Medicaid program. You have to qualify for Medicaid in order to meet the eligibility. So that's kind of the background of it.
So when you say shots, do you mean like what is it, Subutex or?
Yep, there's different. We actually have a few different ones. So we've been lucky and we've had some reps come in and they've educated, being or on some of the new medications they have now available. So we're kind of really in touch with the newest and greatest injections. So we have both injections for the withdrawal, and we also have medication, oral medication. So either or, whatever's going to be most effective for that client.
I said Subutex, I meant Sublocade and Vivitrol.
Yeah, yeah. Yep, exactly. Yep. We have those both available. Yeah, we have some reps that come in and they provide material. So I do provide it to our clients, and I'm sure our coaches and our clients do too. I think that's what they are able to do is reach out to and find those available services for that client. Maybe they need housing. I mean, there's so many different services that they're able to choose from. I know I was provided a manual when I first came in, about an inch thick, and it has everything listed. I was surprised about how many services are available and how we can provide that to the clients. I had a client yesterday that said he got a phone, so we do just about everything as far as trying to reach out and coordinate that for the client. So the reps, like I was saying, they bring in a lot of like journals, education. I do provide that to our clients, making sure that they get that information, especially if they're going to decide to go that route. I want to make sure that they understand exactly what it's all about, what it entails, the safety components of it. So it kind of gives them, and then I answer all the questions about that. It's kind of a program. It's a wonderful program, I'd have to say. As far as since I've been here, I'm impressed with what we have to offer our clients. And
All right.
And they also don't have to be CHS clients. Anybody can be in our health home that wants to join the health home and just have services from our nurse and our PRCs, and so they don't have to be a CHS client either. So
thank you, Amy. Feel free to add anything, Amy, that you
No, you did great.
anything that of value that I may have missed. I just think that, like I said, the availability, having them come in and have access to all these services is remarkable. And the way the program's growing, I've been impressed. Like I said, since I've been here, we've probably had, at least 60 clients we brought on board, I'm guessing.
Okay.
Since you've been here, probably
Yeah, it's
maybe closer to 100, maybe. Yeah.
Could be. So it's growing. It's getting out there. News is traveling, and I feel like it has a lot of benefits to it. And we're learning too, I think, as we go along. We're doing a survey right now to see what we're doing good and, what we're not doing good. And we're going to take that and make some changes based on the survey. So that will kind of help us too.
Linda's got a question.
Any questions? Go ahead.
Yeah, this is probably something I should know, but I'm just going to ask, are you like in a mobile unit? And so people come to the unit, or do they go to the CHS office?
So you can do either. We have some that will come to our office. That they have to come in initially, they have to come in and do that in-person care plan. We do have just initially. And then we do by phone, we do Zoom meetings. So we're kind of open to, it's not a mobile unit by any means. There's offices, in Cadillac and, like I said, Gaylord, Traverse City, Alpena. But we do Zoom and we do telephone based on that client because we understand a lot of them work. So it's kind of hard to, always make that or drive in. So
basically,
we do offer gas cards too.
So basically, you just you help bring the resources together for them to figure out where they need to go.
Correct. Yep. bring them together, kind of help them problem solve. They meet with a counselor, and they kind of figure out where they are, what kind of services they'll need. And so, yeah, there's a variety of looking at them holistically. I feel like,
Yeah.
the counselor, the nurse, all that piece of it.
Yeah, because it's both mental health and physical health going through.
Exactly. Yep.
Yeah.
Yeah, they go together for sure.
All right. Does
So
anybody?
Linda, you were right too. We do have the mobile unit that we might start incorporating to do some of this stuff as well as prevention is going to start incorporating that as well. So yes, you are right. We plan to, but we're not yet, Renee. You're correct too.
Okay.
But it might be a way that we can start meeting clients out where they're at rather than having them come to the main offices. Sometimes they have trouble getting there if they live further out. So that's a good question too.
So there is no mobile units right now, not even on the eastern side.
We have it over here on the eastern side, but we really are just kind of looking at ways that we want to utilize it. So I think it's going to be mostly utilized by our program, the health home, and by your guys' program, prevention, eventually.
Awesome. Anybody else have any other?
Yeah.
We still have quite a bit of time, so.
Well, how do they get started? Like
How do they get started in the program?
how do they hear about it? They're referred, or can they just call Dorothy at the front desk, or I'm sure there's a bunch of different ways people can get started after they hear about the program. So just assume somebody's heard about the program, then where do they go? How do they get started from there, depending on how they were referred to the program, I guess.
So they can, like you said, they could come in anyway. I've had clients that come in off the street, today they need to be seen. And so what they do is they fill out the registration forms just to make sure they meet eligibility. But even if they don't, we still see them. I found that Catholic Human Services is a wonderful means they let anybody come in, I should say, because I've had that before. But we do have paperwork that they have to complete to make sure they meet eligibility, to make sure we could put them in the right spot. But yeah, they could come in, they can call, referral, out the streets.
If you, as a PRC, John, if you're working with a client or maybe who's not a CHS client or something, you can actually just call the front desk and help them get signed up for the health home. They don't have to see a clinician or be an actual CHS client. But a lot of our clients are, and they come through, their intake, and then they go right into the health home once they're identified that way.
Linda's got a question.
Yes, Linda.
Yeah. Are you on the Grand Traverse Access and Crisis Center referral list? And if so, do they know everything that you offer and do?
Good question. I do not know the answer to that, but I will find out.
Okay, because that would be really great. They are looking for referrals in the community. They have a lot of resources there if you have anything to actually leave there, like packets of information, or there is a navigator from NAMI that's there during the crisis, the highest level of people coming in crisis. And that's a big part of her job, is just finding the right resources for not only the patient, but also the family.
Okay. We'll follow up with that and find out, because I don't have the answer. Very good question.
No. Do you have a contact person for that, Linda,
yes, Michael Worth. I'll send you his info, Amy.
Okay. Thank you.
Okay.
Thank you.
So do you anticipating filling gaps that maybe ATS will not be filling as they step back and change their program?
We are hoping so. Yes.
Yeah, that's been a concern in the region.
Yeah. Yes.
Well, and another thing to piggyback off of that is 217 recovery. which has worked pretty closely with ATS, but they are a community-based organization. They are looking for funding, but certainly more partners will help them do that. And I think they're the best of the best. And certainly there's potential of that expanding to Eastern Side or whatever. But they actually will transport people to treatment centers. And they did have some NIMRI monies, which they've lost. So they really are looking for some sustainability, but they are at ATS. I mean, that's where their office is located. They have a podcast. I think they're one of the best resources, but unfortunately, they need more cars and so on and so forth. So any rate, they might be a good person to look at as a resource for us as home health care services expand or recovery care services expand, that we could actually offer transportation.
Yeah, they're great.
Okay.
Great, good feedback.
Have 217 have they expanded to do more than just take people to treatment and back?
I believe they can, and they do, and they will, but then it can't be couldn't be under the NIMRI grant. They couldn't, because it could only be a treatment center. So it kind of depends on what their funding is, as far as how far they can go with it.
And they're not on 8th Street anymore?
They're in ATS. Is that 8th Street? Garfield. It's Garfield.
No.
Yeah.
They used to have an office on 8th Street. That's where I always stopped and picked up materials from them.
Yeah, they used to be right across from the detox facility.
Yeah.
Oh, yeah. They're not there anymore. They're over at ATS. Yeah.
Gotcha. I did not know that. That's good to know. Thanks.
Yeah, I didn't know that either because he did his podcast from there, and he also they had meetings and stuff like that they always had there because they do more than just transport.
Yeah.
So yeah, but you definitely a good group to get in contact with to work with.
This is Lauren. I have a question.
Yes.
So I work with folks that are paroling from Michigan's prison system, and depending on what facility that they come out of, if they are on any sort of treatment, meaning, pills or the shot or whatever that is, some of them come out with 3 days or 7 days. Some of them don't. Some of them have just received their shot. Other ones haven't. Sometimes the facility sets them up with a physician or a pharmacy. Sometimes they don't. So we have some different situations that will just, happen. Somebody comes out, day 1, day 2, they're like, oh crap, I only have 3 days left, or I only have 7 days left. This is particularly a problem in Kalkaska and Antrim County. I haven't had as much of an issue like in Emmett or Grand Traverse because there seems to be more facilities, more resources, but particularly in Antrim and Kalkaska County, could you tell me what would you do if you met someone that just came here and they only have 2 days left? What should they do? Like, what would be step number 1? What do you recommend?
So what I would do is, could you send them to us and we could look at eligibility, and we do have our Freedom Clinic recovery program, and that is ran by Dr. Beatty, and we could make a referral to him and contact him, of course, if it's something urgent, and see what he recommends. So he is part of our team, and he comes in once a month, and we come to Traverse City in the morning, and then we go to Cadillac in the afternoon. So he does have clients that will come here and clients that will go to Cadillac. Plus he has an office.
I guess I should have stated the problem being that most of them that come out have no transpo, no driver's license, and are being placed like in a motel here in Kalkaska or at a transition house. And that tends to be one of the issues. If they had transportation, I wouldn't be asking this question, I guess.
Yep, Dr. Beatty does telehealth, and he's very good about emergency situations like that, where if they were running out in 2 or 3 days. So like Renee had said, if you would just contact our front office and we could get that going, we do have a collaboration with him. Actually, I have a very close collaboration with him. He's over here with me, and I've seen that happen a lot of times where he'll get them in, see them via telehealth, get them going until we can figure out a way, because he does like to eventually, see them, and, make a plan, but he's very good about making sure that they're okay until that happens.
Thank you for that. I
Can,
have one follow-up if nobody minds me continuing.
Well, I can give
Um,
you, if I can give you a quick
oh, go ahead.
example,
Go ahead, John.
a client of mine, who was in prison down in, Ypsilanti. It was a woman. She came, she did it. She was in the exact position you're describing. She came out of jail and it had 2 days left of her Suboxone. And we'd hooked her up with Dr. Beatty. Dr. Beatty did a telehealth, and Dr. Beatty set her up with whatever she needed, and it, and worked with her until she was set with somebody permanent. And now she's been fine ever since.
Good.
So he will work. I mean, he's real good at that.
can I interject too and just ask that
Yes.
a phone number, if there's business cards for this Freedom Clinic? I mean, this is all stuff I've heard about on different Zooms, but I have nothing tangible. And also, if that could be given to the OS reentry program in Grand Traverse County and Kalkaska and Antrim and so on and so forth, so that they know this is an avenue to get help. Because I would say there's a huge gap. There's a huge gap in our community for this kind of help. So if they know this is available and this is a phone number they can call, I think it would be awesome to get that information to them.
Yeah,
Okay, I will make sure. I'll talk to Amy and we'll get it organized and get it to you.
yeah. And if you can create a
Great idea.
you can create a flyer and send it to me, I can send it out to everybody, and then we can all push it out from there.
Okay.
It wasn't a follow-up, actually, it's just a second question. So in talking to managers, owners of sober living houses, I'm seeing a pattern where they are okay with folks being on a shot, but they don't like folks coming into sober living houses either on a pill or a strip, because those things can be abused, traded, sold, etc., where a shot cannot be. If someone were on a pill or a strip, what is the process of switching to a different medication, or is that even possible?
Oh, it's definitely possible. I would have to involve Dr. Beatty, but yes, you can do that. I would have to talk to him, and see what he recommends, but yes, you can definitely switch. We have clients that do that based on availability, yeah, multiple factors.
Is there a period where you have to, I don't know, wean yourself? I'm not sure the right word, but take yourself off of what you're on before you can switch. I'm thinking about that
Right,
overlap period of you don't have anything before you can start a new thing.
I don't know. I think that you can start as long as if you start that pill, go in and see him, and I think there's like a week maybe. Don't quote me for sure, but I think it's like maybe a little bit of time, but I think that it's not that large of a gap there, and then he can get you started on it. Or
I think
Thank you.
that moving from Suboxone to like Sublocade, you're just moving from Suboxone to Suboxone. So it's not, there really isn't any gap.
Right.
It's just a matter of how much, how much of a dose that a Dr. Beatty would probably would want to give, I guess. I worked with Dr. Best when his office was open, and he had a lot of clients that came in, wanted to get off the strips and get onto Sublocade. And I don't ever remember ever having a gap in there or anything, as long as it was the same drug.
so probably when you switch over to a different type, they have a couple different availabilities. Now that might be an issue, but
Right.
sounds like if they're just doing the same medication, it's just different mechanism. So that makes sense. I know the film, I hear sometimes that some of the clients, it does affect their teeth. That is something that, they're kind of resistant sometimes.
All right, any other questions? Great questions, guys.
Yeah, really good questions.
Nothing more? Lauren's right. Kalkaska County, there's such a gap here. We have nothing. And a lot of our people over here, they don't have transportation to Traverse City or Cadillac or anywhere else. They're stuck here. And a lot of them are out in the middle of nowhere. And so it's really hard. And
It
even
makes it a challenge.
yeah, and even to do like telehealth, they have to be somewhere where they could get service because there's a lot of areas, in Kalkaska County that might not have service. They have to make,
Yeah, those rural areas.
yeah, they might,
Sometimes it's hard.
they may not have internet or they don't have a phone or so they're really stuck with no services at all. And we run into that quite a bit, right, Lauren? Especially coming right out of prison or jail, or they don't have these things.
Yeah, absolutely. Even for assessments and classes and such as well, it becomes, they're required to do these things as part of their parole, but how do they get there every week? How do they get home? So yeah, definitely I see it the most. I mean, I don't work in every county, obviously, but I work in Antrim, Emmett, Charlevoix, Kalkaska, Grand Traverse, Leelanau, and Antrim and Kalkaska seem to be the ones with the largest gaps, followed very closely by Charlevoix.
Yeah. It'd be great to get clinics over this way. ATS did have their bus coming in for a little while, and that's gone. So
Well, yeah, well, this is good to know because we have talked about having the mobile unit and Kalkaska has came up multiple times with Dr. Beatty coming over. So that's good. I will pass that information along too. So
absolutely.
Yeah, I'd like to also just kind of put out there the homeless community. And I put a lot of time in at Safe Harbor. And so if they come out of jail and they go to Safe Harbor, they maybe haven't had their drug of choice, but there isn't that connection to do the Suboxone or get an assessment or get any kind of care. So they go back to their old ways and it becomes a revolving door. So if there is a way for that connection for what these services are, and even if Safe Harbor knew about the Freedom Clinic or the telehealth, they could try to get these newcomers maybe hooked up with some services, especially if they've come from jail and they've ended up there.
So I wonder a flyer, like you had said, maybe handing out a flyer or something with the information on it.
Yeah, that would be really great.
Yeah.
Yeah, for
Safe
that
Harbor.
demographic too.
Right. Yeah, definitely.
yeah,
Safe Harbor's got a mobile unit there now. On Tuesday, at least on Tuesday nights when I'm there
Yeah,
with my
they
resource
do.
table, they have a mobile unit that takes care of any of the people that need medical services.
Yeah,
And then
that's true.
they're also at the Methodist Church on Thursday mornings when I go over there with the resource table.
I don't think they have as well-rounded program
It's possible.
as we're
I don't
offering through
know.
our home health care, though, having a counselor and all of that tied into that health assessment. So it might be nice to just get that out there a little bit. That's all.
well, and there's services offered to the Grand Traverse Jail through Catholic Human Services, correct?
Yes.
So that
They
should
do go into the jail. Yep.
that should be, I mean, easy to connect for people leaving incarceration.
Mhm.
It'd be easier to offer. And Kalkaska folks that are incarcerated are down in Wexford County. So CHS is also.
Oh, okay. We service Wexford too.
Yep. So just getting the word out, being able to promote the program.
Exactly.
Yeah. All right. Any other
And
questions?
we do already have a flyer too, and it does have all of, Dr. Beatty's info on it as well. So I will send that to you, Suzanne, and you can, and Linda and John, and you guys can get it out to whomever.
That's
It's also on Facebook. I see it on Facebook. So I think that's reaches out. I mean, a lot of people are on Facebook, so
yeah,
I do see it.
yeah. We can share it through
It
that.
helps too.
And so, all right. All right. Well, it's a little bit early, but that's fine. Does anybody else have any questions or comments or want any other information? No? All right. Well, our next Coffee with the Coalition Forum will be on Tuesday, November 25th, right before Thanksgiving at 9 a.m. The speaker and topic is to be determined.